Hello everyone, I'm Oliver Filutowski and I'm an intern at USF. So today we're going to talk a bit about nights. We'll go through preparing for nights, receiving sign-out, speaking with nurses, getting ready to give sign-out, and then also self-care. Okay? So preparing for nights is important. It's going to be a change in your sleep schedule. It's an entirely different rotation. So as best as you can, sleep well beforehand. Bring your food because there aren't many opportunities to go and get food. The cafeterias are generally closed, and perhaps you can call in some, but it's good. It's good to be prepared. Also, plan to be on time because driving during the daytime to get to a night shift may be completely different in terms of traffic, and you want to be respectful for the teams that are waiting to sign out. And then also know your backup. Know who the senior residents are on the MICU, the CCU, who your attending is. That way, when there are issues, you know who to contact. And they are always there for you. And that's important to remember throughout the night. So when you're actually receiving sign-out, you're getting a condensed amount of information on a number of different patients. For me, sign-out would often take 5 to 10 minutes per team, which seems pretty extensive. But I wanted to know enough about the patients to make wise decisions should anything go south. So ask questions, ask away, and teams generally understand. And they may even ask you, how much do you want to know about these patients? For any new patients, I wanted to know just a few lines about them. What brought them in, what has been done for them, and how they're doing now. And then you may hear things like the patient is a low threshold for transfer to the MICU, meaning they're borderline unstable. And so I wanted to know, is there a hospital course written? In other words, if I need to transfer this patient, am I able to do it quickly and sign a note? Or do I need to go digging through the charts and try to piece together what their whole hospital course? And generally, hospital courses should be written for you. And it makes for a good continuity of care and clear transfer of information. So when you're receiving sign-out, you may, just a few examples, and these will all be gone over in more detail with you all at a later date, but just some examples of grading the severity of an illness and then knowing what to do in a situation about it. So for anemia, asking all sorts of things about, have they needed transfusions, are they consented, all of this so that if their hemoglobin is low, you're able to quickly transfuse them without stumbling and trying to figure a lot of other information out. Same thing with high potassium. Are there EKG changes? Is this patient unstable, or is this asymptomatic hyperkalemia and it'll come down on its own? And the same thing with altered mental status as well, and a number of other conditions. But ask questions so that you know how severe this disease is, and then how do I manage it if the patient starts to decline. Speaking with nursing is incredibly important. You all are colleagues, and it's important at all times, no matter what, be respectful, be patient with the nurses. We often don't understand what they are doing on a daily basis, so without actually truly knowing that, always give the benefit of the doubt. And you may get called for things that, like diet orders and things like, the patient doesn't have labs for the morning. Be patient with them. There's no need to get frustrated with that, and be grateful that they're checking up on their patients and concerned with their care. If you get called for pain, something I always asked was, is the patient maximizing their PRNs? Because oftentimes a patient may request something that the primary team hasn't given them. And as somebody who's covering overnight, my job is to ensure that patients are receiving the same care that would be given to them during the day throughout the night. So always ensure they're maximizing their PRNs and doing the bare minimum before escalating in, for example, pain management. And then always reassure the nurses that you're here for them. There's not a distance between you two, but the reassurance goes a long way, and I know the nurses really appreciated it. And throughout the night, in preparation for sign-out in the morning, you want to be documenting everything that you do. That's at least what I did. So even ordering new diet, anything, I wrote down so that I could communicate to the teams in the morning. Document any time you go and see the patients, and if there are recurrent issues, address that with the team. If you're constantly being called for high blood pressure and their systolics are in the 170s throughout the day, say, could you give something so that I can have it overnight? Because overnight we can only order one-time doses. And the last component, and which is very important, especially on nights, is good self-care. Make sure you're eating and sleeping when you can. You may notice some patterns in pages where it ebbs and flows, and try to plan around that. Know that you always have backup. Ask your seniors for help and guidance, and ask them to come and see patients that you're concerned about. They're happy to do it. And then it doesn't need to be stressful. You can really have fun with this. It's an opportunity to be very independent, to really be able to practice medicine in a different way that you haven't before. But always ask for help. Thanks. And so to conclude what we just talked about, we went through preparing for nights, how to receive sign-out, interacting with nurses, how to prepare to give sign-out, and then how to take care of yourself when you're on nights.
Right. Hey Oliver, I have sign-out for you today for Team 5. So, I'm going to tell you first about our watchers. We have Mr. S, Mr. C, and Mr. A. Mr. S is a guy who's coming in for pancreatitis. He's here a watcher because of pain control overnight. He's got some Dilaudid right now, but he may need some additional pain meds overnight, so he might get called.
Okay, and what do you recommend?
So he's opioid naive, so I'd be definitely careful in giving him anything additional. If you want, you can try some NSAIDs for him, maybe some IV Toradol if he's nauseous.
Great. And do you know if he has a bowel regimen with the opioids?
He does. He
okay.
does. He has some scheduled NPRNs, but you can go up if you need to.
Sweet.
The next one we have is Mr. C. He's here for failure to thrive, and he recently had an aspiration. He's on antibiotics right now, but he's a watcher for any sort of a respiratory distress he may have overnight.
Gotcha. And how's he breathing now?
He's on room air,
okay.
No respiratory distress right now. When he first came in, he was on 6 liters, but they weaned him down. He's on appropriate antibiotics, but if you need to expand them, you can. He is MRSA positive, but they didn't think his chest x-ray looked that terrible, so MICU had just put him on Zosyn. But we're planning on de-escalating it tomorrow since he's doing so well.
Okay. And I see like low threshold for transfer to MICU, like is a hospital course written for him?
He does have a hospital course because he was just sent from the MICU, so there's one there on our note as well from the transfer note. But I would be very concerned for him overnight because he has such a high aspiration risk. So I would just keep an eye on him. If you get called for any respiratory distress, I'd repeat the the chest x-ray and the ABG and just take a look at him.
Great. And is he with it? Does he have family that knows about what's happening?
Yeah, his wife's usually there every day. She may not be there overnight, but he's like alert and oriented times 1, 2 at best. He's got some baseline dementia, so I wouldn't be super concerned, but he has been a little altered while he's been here since some delirium, so
okay.
That's a baseline that you should know about.
And then also Mr. H for anemia? Is that right?
So he is coming in for a GI bleed, and he's going to be getting some blood today, and we're just following up on the post-transfusion CBC just to make sure it's responding appropriately. His last hemoglobin, I believe, was 8.
Okay. And if it's still low, still transfuse? Okay. And he's been consented in with us?
Yeah, because of this last one.
Perfect. And then awesome. All right, thank you.
No problem.